My name is Dr. Edward Lewis with Spinal Health and Nutrition. Today, we're going to talk about the most common arthritic condition that's affecting millions of people, millions of adults, and it is called osteoarthritis. Okay, what is osteoarthritis? It's a chronic condition where the protective cartilage that is located in between each joint of the body begins to wear down. What areas of the body has this type of condition? Okay, our hands, knees, our spine, hips, and ankles. 80% over the age of 65 within the adult population has this condition. But it can also affect our young adults or adolescents. Today, we're seeing a lot of kids, or noticing that there's a lot of kids and young adults who are not active. Long periods of sitting, once again, obesity. Those two factors can actually lead to osteoarthritis. So what is the cause of this condition? Number one, joint damage due to injury. Whenever we have some form of injury, whether it be a slip and fall, auto accident, a sports injury, and it never gets addressed or treated, the good news is our bodies is a self-healing process, but the way it heals itself is that it's going to produce scar tissue around the joints, which can lead to osteoarthritis. The body also produces inflammation, okay, which is a form of toxins during the healing process. Inflammation can lead to weakness of the muscles and bones, which can gradually begin to break down the cartilage that is located in between the joints. So we have to get this addressed. We can't avoid any type of injury that occurs in our bodies once we go through some type of accident or sports injury. Overused wear and tear on the joints of the body. For example, mechanics constantly bending, using hands, working on the cars. They put in overused wear and tear on those joints. And eventually the cartilage that surround those joints are going to gradually wear down. Obesity. Do you know that between the lower part of the abdominal region and the hips, that's where our center of gravity is? But when we are obese, that can cause that center of gravity to increase. And that can lead to speeding up the process of causing wear and tear on the joints, okay? And also metabolic diseases like diabetes and iron deficiency. Whenever there's an excessive amount of glucose in the bloodstream, that could also lead to inflammation around those joints, which will break down those joints, producing wear and tear on a particular area, okay? So what I have here is a model of the spine. If you look in between the bones of the spine, we have the disc, okay? So whenever there's an injury, whenever someone is overweight or obese, that puts a lot of pressure on those discs. The discs are responsible to prevent pressure or too much pressure on the bones and also too much pressure on the nerves. When those discs wear down, that creates an excessive amount of pressure on the nerves, leading to joint pain and stiffness. Also, when the body notices that there's a change due to the disc wearing down, due to wear and tear on any type of cartilage that's located on the joints, it will produce calcium deposits around there, which is also known as bone spurs, which will lead to symptoms with this condition. So what are the symptoms? Of course, one of the symptoms are joint pain and discomfort, but we can also experience stiffness, lack of range of motion. Now, you may hear a lot of people say, hey, I noticed that when it's cold outside or it's raining, I feel more pain and stiffness in my joints. Is that a myth? No, it's not a myth. That is true. Because our muscles, ligaments, and joints are controlled by the atmospheric pressure in the air. So whenever it's getting ready to rain, people will experience more pain on their knees. They have arthritis on their knees. They will experience more pain on their neck and lower back if they have arthritis in those two areas. Whenever the temperature drops outside in the winter time, they will also experience more pain and stiffness, because when it's cold, the joints become more cold and stiff, and people will experience more limited range of motion. So I want to go through some simple treatments for this. Chiropractic care. Can chiropractic care reverse osteoarthritis? No, but we can prevent it. We do not want this condition to get worse, because if it gets any worse, that can lead to having a bone fusion done or surgery. Okay? We don't want any doctors to go into our spine doing any type of surgery, putting screws or plates in there, because oftentimes after the surgery, we may come out worse condition or shape than going in. Because once they put those screws in place in our spine, that can definitely cause some limitations on our flexibility and range of motion. So once we see that we have this condition on X-ray or MRI, we have to do something about it immediately through chiropractic care, because the chiropractic adjustments will help reduce inflammation. It will also help restore our functional range of motion. And also with chiropractic care, there are other modalities that we use when it comes to our treatment plan. We use this device called a modality ultrasound. Modality ultrasound will produce an ultrasound wave that goes deep into the tissues of our spine and joint, which will help break up any scar tissue or calcium deposits. And it can also help reduce muscle spasms, inflammation, or toxins. Cold laser therapy, which does the same thing. There's also a very popular modality called shockwave therapy. Shockwave therapy will help increase circulation around the injured area so that the patient can get more momentum or movement on the area, and also help to restore functional range of motion. Once again, an exercise program. Simple things like walking, doing other exercises that are non-weight bearing or non-impactful or stressful on the joints and spine, such as swimming. Swimming is a very good exercise for the joints. We must get into some type of water aerobic or aquatic program, because the water will help take all the weight off the joints to help increase our flexibility and also decrease the pain and stiffness. Exercise like biking to get the joints moving on the knees and ankles, another good exercise. Losing weight, you simply have to lose weight. Going to see a chiropractor is a good thing, but we must do our part outside of chiropractic. We must work on getting on a simple weight loss program, because the more weight that's being lost, the more pressure is being taken off our spine and also our knees. When there's too much excess weight around the hips, around the lower lumbar region, that can create a lot of weight on the hips, on the knees and ankles, leading to joint pain and stiffness. So once we are diagnosed with osteoarthritis, let's attack this immediately. We can do this. There are some simple ways to execute this condition. I am Dr. Lewis. Please share and subscribe to our YouTube channel. And remember, your health is your greatest investment.